Good morning, I'm Mabel Jong and you're watching the World Healthcare Congress Interview Zone. I'm back with Dr. Joseph Kvedar, who is Director for Center for Connected Health at Partners Healthcare. Good morning.
Hey, good to see you again.
Good to see you. And we're going to talk about addiction. In this regard, a good one. Health addiction? Let's give you the details.
We spent so many years, Mabel, understanding how feedback loops can help with understanding your health, whether it be tracking your activity, your blood pressure, that sort of thing. And what we really discovered was that in the case of patients that we monitor and have great success with, whether it be diabetic patients or patients with high blood pressure or what have you, most of the time they stay engaged with those feedback loops because they'll know that someone in their doctor's office is paying attention.
Okay.
And so we got to thinking about that, and the other thing that comes up all over the news these days is how often people check their smartphones, 150 times a day.
Wow.
And so we got to thinking if there was a way that we could harness that way you're always on your smartphone and almost subliminally put in health messaging there, that we might be able to engage people without having to have their doctor involved. So it's a new concept, something we're working on, thinking about a lot. I think it's quite compelling, and we're excited about it.
Okay, so what's behind it? You're talking about putting positive messages on your phone that might ring at certain times of the day, or?
Well, for instance, if you've heard of an app called Google Field Trip, you download that to your phone. It runs in the background. In a place like Boston, where I'm from, it rings a lot because it vibrates really. But when you pass a historic building, it will vibrate, and you can pick up your phone and read all kinds of interesting things about that building. So it's location aware. The same kind of technology could be used if we knew your health goals, if we knew your calorie goals and your activity goals, because we can track your activity on the phone already with the accelerometer. So if we knew your calorie goals and your activity goals, we could remind you as you were passing a healthy food option that would be a good choice, or discourage you if you were about to head into McDonald's for lunch. That's an example.
Okay. How are we at getting people motivated to do the right thing? Is that going well, or are there still some pretty obvious challenges?
The challenges there are, but I think we're starting to get insights as to how we can overcome them. So one challenge is we talk down to people about their health and their illnesses. We use terms or phrases like, if you don't lose 20 pounds, you're going to have a heart attack. That's not really compelling. But that same person might want to lose, maybe not 20, but maybe that same person wants to lose 5 pounds to fit into an outfit that makes them look slim for their daughter's wedding. It's really about the messaging and about using things like social networks and personalization. There's a whole series of things we can do nowadays. We just haven't caught on to them in healthcare yet, and we're just starting to really understand that our age-old way of taking care of you. Now, by the way, if you came into the emergency room, God forbid, with a car accident or chest pain, that's the way we think, like you're really sick and you need a doctor. But with chronic illness management and prevention, it's a different ballgame.
Do we run the risk, or are you always keeping in mind that you don't want to give too much information all the time, so that people don't feel inundated with information?
Right. On the other hand, these days of 140 characters bits, we can work with that pretty well. I'll give you an example. We created a program. This was many years ago, before smartphones, using text messages to encourage people to use their sunscreen, and it worked. Every day, a text message to these folks really enhanced their sunscreen use, and we were able to measure that. When we asked them why, they said because they opened the message every morning to get the weather report. They didn't really notice the sunscreen message. So it's that kind of thing. Give them something of value, put your health message in next to it,
Nice.
and it becomes top of mind.
Okay. Let me ask you, are there industries that you could take examples from that have been very successful in motivating people in certain areas?
Well, we're taking a lot of cues these days from how the advertising industry is going. For instance, the billboard and the print ad are going the way of the 8-track, and there's a reason for that because they're non-specific. Everything you get on your mobile device or your web browser these days is personalized, and it's personalized based on your own behavior online. We think there's an opportunity to use that same kind of approach, what I call gathering your digital breadcrumbs, and analyzing them and presenting them as a very personalized health messaging opportunity. It won't be the same as advertising because sadly, making an impulse purchase is a much easier thing to motivate than a healthy behavior. But there are other industries, for instance in financial services, people are using big data and analytics to target individuals who've missed one loan payment.
Right.
And if you've missed one loan payment and they can get you back, that's something they really want to do, because once you've missed 2 loan payments, you're a bad risk.
Right.
And that to me is much more like motivating to do something healthy. So we're really interested in learning how these other industries are using analytics to promote behavior change.
Okay. Dr. Kvedar, I really appreciate the check-in.
It's always a pleasure.
Thank you
Take
so
care.
much.
All right. Stay well.
And I'm Mabel Jong. Thanks for watching.